Now, remember that both of them are basically gonna work in tandem with one another. So we're gonna, if we're dehydrated, not only are we gonna get thirsty to increase our blood volume, but we're gonna hold on to water too. We're not gonna pee as much out. All right, so whenever you're thinking about this, if you're asked this on the homework or on the test, right, think about what would happen in your body if you either were really hot and didn't have water on you, or if like all you did was sat down and drank water all day, right? Think of what would happen. How often would you go to the bathroom? What color would your urine look like? Would you be thirsty? Would you feel full? Okay, all those things. So I think we did this, did we do this graph?
Yes, no.
Okay. So one of the things that I don't love about all the graphs in the book is I think they go into it a little bit too much, right? So the thing to remember with the ADH release is that it is going to be regulated by just a couple of things, all right? The main two things are the fact that our blood will be more concentrated. So that's an increase in the osmolarity, okay? And the other thing is that our blood volume and blood pressure will be decreased. So a decrease in blood pressure and blood volume and an increase in the concentration of blood is what's gonna stimulate ADH release, okay? The thirst mechanism has a few more inputs, right? It's still gonna be our increased blood volume, or excuse me, not increased, our increased blood concentration, right? So our plasma osmolarity is gonna be increased, and it's gonna be the decreased plasma volume, blood volume and blood pressure, but it's also gonna be something like if we have dry mouth, okay? But both of them are gonna work at the same time. We'll drink more, we'll hold on to water with our kidneys, and we will wind up, okay, restoring our plasma osmolarity to normal and restoring our blood volume and blood pressure to normal. So these are negative feedback mechanisms. Once balance has been restored, then we will inhibit thirst. We will inhibit ADH release, okay? Okay, so our solutes, the solute levels in our body play a really important role in either water retention or water loss, okay? And the most important solute in the body that affects water volume is sodium, okay? Water's going to always follow solute, but sodium is the most important thing that it follows, okay? 3 hormones are going to determine how much sodium is reabsorbed in the kidneys, okay? The first one is aldosterone. That's really the big one, okay? So aldosterone works on our collecting duct. Do you guys know what the DCT stands for? I'm getting a little
Duct.
ahead of ourselves. Distal convoluted
Oh.
tubule. Okay, so I'm getting a little ahead of myself. You could just write for now. In the next test, you'll need to know it, but for now, you just need to know the kidney. And what it does is it promotes sodium retention. Right, so instead of getting rid of it in the filtrate, we're gonna bring it back into the blood, okay? And then if sodium is being retained, what's gonna follow it?
Water.
Water. So let's just not worry about this yet, okay? So sodium and water retention by the kidneys. Okay, angiotensin 2 affects sodium reabsorption because one of the things that it stimulates is the release of aldosterone. So that's how it works, okay? Okay, so both of these, right, are going to act to increase our blood volume and blood pressure. Okay, and ANP, our atrial natriuretic peptide, is going to do the opposite, right? So this is released by our atria in our heart in response to stretch. So if our blood volume is high, God bless you, God bless, it's gonna cause stretch in the atria, and that's gonna trigger the release of ANP, okay? Okay, so what that's gonna do is that is going to decrease, okay, or maybe what should I say? It will cause, bless you, sodium and water loss by the kidneys. Okay, so it'll have the opposite of effect of the aldosterone. So if it causes sodium and water loss, how is it gonna affect our blood volume and blood pressure?
It's down.
Yeah, okay. So it's gonna decrease our blood volume and blood pressure. Yeah. Hey. Hi. Somebody keeps stealing the erasers in ATAC, and I used paper yesterday to erase the board. All right. Any questions on that? Okay. So this just kind of goes into a little bit more detail, right? There's not much left to tell you about aldosterone, other than that it works on the, or is produced by our adrenal cortex. So if this is our kidney, this is our renal pelvis. Okay, here's our blood vessels. This is our ureter. Right, our adrenal glands is up here. So if we cut open our adrenal glands, we'd have the medulla in the middle. And that releases epinephrine and norepinephrine. And then the outside is our adrenal cortex. Okay, the adrenal cortex releases a whole bunch of hormones. There's like different zones in it, but one of the things that it releases is aldosterone. Okay, so basically what it's gonna do is it's gonna hold on, make the kidneys hold on to sodium, and water's gonna follow it, so it will cause an increase in blood volume and blood pressure. Okay. So angiotensin 2, we said, does it indirectly. So I guess I did this to try to set up our feedback mechanisms to see how that works. So right, if our blood volume and our blood pressure, let me do it in a different color so you can see it easier. If our blood volume and blood pressure are decreased, right, that is gonna be sensed by our kidney, right? Those juxtaglomerular cells that we talked about, okay? So our kidney will secrete renin, okay? When renin is released, right, that's going to cause that cascade of events. Do you guys remember that? So renin, all right, we have our angiotensinogen. That's going to be turned into angiotensin 1. Okay, angiotensin 1 goes to the lungs, where angiotensin converting enzyme puts it into the much more powerful active form angiotensin 2. Okay, angiotensin 2, remember, has 4 effects on the body. Number 1, it causes the vessels to vasoconstrict directly. Okay, it's going to stimulate ADH release. It's going to stimulate aldosterone release. And it's going to activate the thirst center. Okay, so vasoconstriction, what's that going to do to our blood pressure?
Increase it.
Right, it's going to increase our blood pressure. Doesn't do anything to blood volume, just increases the blood pressure. What does ADH do? What did we say antidiuretic hormone does?
It
Increases volume.
decreases blood volume, increases plasma osmolarity, which decreases blood pressure.
Good, so it increases blood volume, it decreases plasma osmolarity, so, right, water retention. Right, and we said that is gonna increase our blood volume and blood pressure because our kidneys are holding on to water. Okay, we just mentioned, how does aldosterone work? Our kidneys are gonna do what?
Sodium and water retention.
Good. So that is gonna, God bless you.
Thank you, thank you.
Increase blood volume and blood pressure. And then if our thirst center is activated, what are we gonna do?
Drink.
We're gonna drink. Now, hopefully, we drink water, we don't drink coffee, or we don't drink alcohol, right? Because coffee and alcohol,
Diuretics.
yeah. They promote diuresis, right? So we'd be worse off with those, okay? So if we drink water, again, what that'll do is that'll increase our blood volume and blood pressure. So that's like the very roundabout mechanism of affecting sodium. Okay, but in general, overall, right, angiotensin 2 is a very, very powerful determinant of blood volume and blood pressure. Okay. All right, so anybody have any questions on that?
Will this be specifically on the test, the flow? The
You
width?
should know it.
Okay.
Yeah, you should know it. I don't think I'm gonna make you draw it, but like you should be able to kind of follow the flow of it. So if blood volume is decreased, or if a person is dehydrated, how would X, Y, or Z be affected?
Okay.
Okay? All right. Now, the other one we mentioned has the opposite effect. So ANP, or atrial natriuretic peptide, is going to do the opposite, right? It's gonna increase water loss and sodium loss by the kidneys. Okay. So in response to stretch, right, if our blood pressure's high, it's gonna put a little bit of pressure on the outside of, I shouldn't say the outside, but it's gonna put outward pressure on the atrial walls, and that's going to cause the release of ANP, okay? Natriuresis means that we are getting rid of sodium in our urine, okay, natriuresis. And we said that wherever sodium goes, water's gonna follow, okay? Essentially what atrial natriuretic peptide does is it inhibits those other A hormones we talked about. So it's going to inhibit ADH, it's gonna inhibit aldosterone, and it'll inhibit angiotensin 2. It's also going to cause dilation of the blood vessels. So the overall result is that it decreases our blood volume, okay? And it decreases our blood pressure. They have something very similar to this in the hospital called BNP, beta natriuretic peptide. It's a medication that is probably like one of their most potent diuretics. So if we have patients that are holding on to a lot of water, right, heart failure patients in the hospital, they give them BNP to try to get them to eliminate as much fluid as possible. All right, so I'm gonna skip this again because I think that there's just way too much on this. Okay. So here's our summary of our A hormones, right? We have ADH, increases blood volume and blood pressure by holding on to water. Okay. Angiotensin does the same thing except it holds on to sodium, and then water will follow. Angiotensin 2 is going to work by those 4 mechanisms we talked about: direct vasoconstriction, activation of the third center, stimulating the release of ADH, and stimulating the release of aldosterone. So again, all of these are going to act to increase our blood volume and blood pressure. And this will do the opposite. So I think the last thing that I have on here is we are gonna talk about, dehydration, and we are gonna talk about hypotonic hydration, which is like the opposite, overhydration. Right, so, I don't know if you can see this okay. All right. So basically what this shows us is that at the very top, right, this basically shows us our conditions. What, on the top is what's stimulating these actions to occur, okay? The green represents our renin-angiotensin-aldosterone mechanism, okay? The tan represents our sympathetic nervous system effects, okay? And then the purple represents our ADH effects, okay? So this is okay, so let's go over one of these at a time, because they're all gonna work together to achieve the same goal. If our body senses a decrease in blood pressure and blood volume, all right, basically what will happen, let's do sympathetic, okay, first, is that our baroreceptors are inhibited, okay? So if our baroreceptors are not sensing stretch, then the sympathetic nervous system is gonna respond, like, oh, why aren't these stretching? Must be that our blood pressure is too low. So what will happen is the sympathetic nervous system will act on our blood vessels to constrict them, right? Vasoconstriction will act to
Artificially increase blood pressure.
exactly. Okay, it's gonna increase blood pressure. So, here we see, by increasing the vasoconstriction, right, we're gonna increase blood pressure. So sympathetic nervous system causes vasoconstriction, and that increases blood pressure. If we have a decrease in blood pressure and blood volume, okay, that is going to be detected by our hypothalamus. Okay, our hypothalamus is going to sense the increased concentration of blood, okay, and we're gonna release antidiuretic hormone. So antidiuretic hormone will cause increased water retention by the kidneys. And what does that do to blood volume? If we hold on to water, we're gonna
Increase blood volume.
increase blood volume, and then that's gonna increase blood pressure. Okay. Over here, okay, if our kidneys sense decreased blood pressure and blood volume, right? Those juxtaglomerular cells are going to sense that low pressure and respond by releasing renin, okay? Now, another thing that we are gonna talk about when we get to the urinary system is those macula densa cells. But right now, all you need to know is decreased perfusion of the kidneys will result in renin release. Okay, so basically renin will convert our inactive angiotensinogen to angiotensin 1. Angiotensin 1 will be converted to angiotensin 2 in the lungs. Okay, and then we said angiotensin 2 has a bunch of different effects, right? Number one, it's gonna cause vasoconstriction. which we already know from here increases our blood pressure. Okay, it's going to stimulate the release of aldosterone, which will hold on to sodium and water resorption. Okay. Angiotensin 2 will act on the posterior pituitary to release ADH, which will hold on to water. Okay, and then what's not shown here is our thirst, right? So it's gonna trigger thirst, and then we'll drink. So all these things are working together, all right, and the end result is increased blood pressure and blood volume. So as soon as this happens, as soon as we restore the blood pressure and blood volume back to normal, right, then basically what's gonna happen is, right, this will be inhibited, right? Our baroreceptors, right, are gonna stretch, so that'll inhibit that. Right. And then over here, this is going to affect the stretch in the afferent arterioles. So our renin will be inhibited. Okay, so negative feedback mechanism, right? Once balance is restored, we don't need these things to continue, because otherwise that's gonna make our blood pressure way too high.
So does this only happen when there's something wrong, or is it just continuously happening anyway?
It's continuously happening, it's just happening at low levels, right? So it's kind of like always trying to maintain it within a certain range. So, there are conditions where people have problems with this. We have something called SIADH, like syndrome of inappropriate antidiuretic hormone release. So they release too much ADH. And so what happens is that
They're always thirsty.
they're always thirsty, their blood pressure is always really high because their kidneys are constantly holding on to water, right? And then we have another condition called diabetes insipidus, where our kidneys don't respond to ADH. And so what do you think's happening there? If our kidneys aren't responding to ADH, then what are we doing all the time? We're peeing all the time. We're constantly thirsty. I'm not sure if the SIADH results in thirst, but the diabetes insipidus does, right? Because you're constantly losing water. Your kidneys can't hold on to it. Okay. The last thing that I want to talk about is hypotonic hydration. So basically what happens in this is that our plasma osmolarity decreases. So our blood is diluted. There's too much water, not enough solute. Okay? And so there's a couple things that can cause this. All right? So one of the main things that actually screws up blood pressure is kidney failure. Right? And normally you would think like, how's that gonna work? But you saw the whole thing with the renin, angiotensin, aldosterone mechanism is mediated by the kidneys. We determine sodium and water release or reabsorption by the kidneys, by those hormones. Okay, so renal failure can also affect our solute concentration here. Okay, so if our kidneys don't work, then we can screw up our electrolyte balances. Another thing we mentioned, right, if we have too much ADH, so that can be due to a tumor, by a tumor in the pituitary gland. And another one, and I think we talked about this last time, when we were talking about we. Did we talk about
the we,
P for we contest?
yeah.
Alright, so excessive intake of hypotonic fluid. So if we have somebody who is, you know, outside, like a lifeguard, right? On the beach, one of our learning assistants is a lifeguard on the beach. And like say that he was outside, it's 90 degrees, there's no wind, right? And all he has is water, right? So if he keeps drinking that water, right, and there's no electrolytes or he's not having any food with it, what's gonna happen to the tonicity of his blood?
What's an electrolyte imbalance? But I don't know what.
Yeah, it's gonna keep getting diluted and diluted and diluted, right? So the fluid becomes hypotonic, alright? So we said if our cells are subject to this hypotonic fluid, okay, which is what happens when the fluid is diluted, which way is water gonna go?
Was it in?
Into the cells, right? So our cells swell, okay, because the water keeps going into the cells where there's more stuff. And again, the first things that are gonna happen is the person is not gonna feel good. We're gonna get vomiting, maybe we're gonna get confusion, we could get muscle cramping. That muscle cramping is due to the dilution of the electrolytes, right? Magnesium, calcium. And then the brain swelling is what's gonna cause the confusion. And if something's not done about it, then that could lead to convulsions like seizures, coma, and death. Right, so it's not good being dehydrated, but it's also not good being overhydrated. Okay, so do you want to do these practice questions, and then I have some quiz questions. So for those of you that came in a little bit late, we decided, it turned out that most of you came, but we thought that most people weren't showing up. We decided that for the kidneys, we were supposed to start the kidney lecture today. I'm gonna have you guys watch the lecture recording on the kidneys, and today what we're gonna do is we're gonna do some review for the next exam, which is on Monday, okay? So we'll do these practice questions, and then your textbook has some like quiz show type games that we can do. I don't know what the questions look like because I didn't make them, so if they're like too far from what I would ask, we'll just skip that particular question, okay? Because I don't want you to stress out. All right, so what are two major fluid compartments in the body? Why don't we do, right, use your notes, okay, and we're gonna do some extra credit. So this is 5 points on your last homework assignment, on what, is it blood vessels 2? So raise your hand, and then I'm gonna try to make sure that everybody gets called on. So we can name the two major fluid compartments in the body. Anybody? Nadine?
It's the extracellular and the intracellular.
Right, so our extracellular fluid and our intracellular. Okay, and then if we talk about the extracellular fluid, right, our extracellular fluid can be divided into what? Martin?
Plasma and interstitial fluid.
And which one is the fluid that surrounds the cells? here's our cells. Here's our capillaries. So where's our, okay, where's-
Interstitial fluid?
yeah, so interstitial fluid is around the cells. And then our plasma is gonna be in the capillaries. Sometimes it helps to see it in a picture. Okay. And if somebody can just do me a favor at the end of this, if you could take a picture, cause sometimes I'll erase it and then I'll forget. Okay, so, that's our interstitial fluid. And in which compartment is most of the water found? Gianna?
Intracellular fluid.
Good. Okay. Right, so about 2/3 intracellular, about 1/3 extracellular. All right, so the movement of water molecules from high to low water concentration.
Is that osmosis and passive? Is that osmosis and passive?
Yes. Okay, so osmosis, and it's a passive process.
Time.
Right.
Sorry, for the last one, what component is the majority found in?
Intracellular. The concentration of sodium is highest where?
Extracellular?
Say it again.
Extracellular?
Good. Okay. Your last name is B, right?
Yeah.
A-B. Okay, awesome. If a cell is placed in hypertonic solution, what's gonna happen to the cell? Jake?
Prenate.
Good. Okay. What's the main ion that drives water movement in the body?
Sodium.
Sodium.
Good.
Come on, April. Got that. You had that one. Oh.
Guys are doing awesome. All right.
Beverage.
So the main contributor to water intake in the body, April.
Is it beverage?
Yep.
You're literally drinking one. That's a diuretic though.
What structure or hormone regulates water intake?
The center.
Good.
Wait, we'll split the points. Okay. You really got 100. Get out of here.
Okay. When a person is dehydrated, okay, what are the ways in which the thirst sensor is activated?
Well, blood pressure's decreased. I know. Is that in there? Maybe I can't read that.
All right. So, anybody that didn't get a chance to answer yet?
Oh my god, I'm so thirsty.
It's okay if you get it wrong, guys. Just remember that.
Still get points?
You don't lose points.
Oh, okay.
On the test you do, but not here. Alright. So I saw Nadine's hand up first.
Your blood pressure would be decreased.
Good. Okay. Anybody else?
Dry mouth.
Gianna?
Increased plasma osmolarity.
Good. So that means that our blood is concentrated.
Oh, dry mouth.
Okay.
Get those points.
Raise your hand, please. I bet you got in trouble when he was little in class.
Still do, apparently.
Sorry, that was a cackle. Right? Anybody that didn't get a chance to answer yet? Any?
Is it the atrial, the third last one, the atrial, I don't know how to pronounce it, no?
Call on you when it's time. I'll call on you when it's time for that one. April.
Is it angiotensin too?
Yeah, okay. Remember that one of the effects that angiotensin 2 has is it triggers the thirst centering.
Nice. You got that 0 last time.
Okay. What is the hormone or structure that regulates water output?
Diuretic hormone.
Good. What hormone stimulates reabsorption of sodium? Ariana?
Aldosterone.
Excellent. Where are you? And what is a major organ responsible for maintaining fluid and electrolyte balance in the body?
Oh,
Kingsley.
damn it. Yes.
Good.
So easy.
Excellent job, guys. Geez, I had a lot of questions. All right. This should help you with your homework too. When a person is dehydrated, okay, would the following hormones increase or decrease in response? So let's do the first one, ADH. So
Doting?
we're saying in response. If somebody's dehydrated, how would our body respond? All right, so Gianna?
Increased?
ADH.
Okay, so we increase ADH. How about ANP?
Decrease.
Good. Where'd you go? All right. Aldosterone. Page, increase. Okay, and angiotensin 2?
Increase.
Okay. What structures in the hypothalamus detect changes in the osmolarity of blood? Anybody that didn't have a chance to answer wanna try? Okay, now it's open to anybody.
Osmoreceptors.
Good. So, remember our different receptors, right? Osmoreceptors detect changes in the concentration. All right, what detects changes in pressure?
Baro something. Baro something.
Neuroreceptors.
Good.
No. Sorry, I missed out on everything. I'm okay.
And how about oxygen, carbon dioxide, and pH levels? You're on fire, Martin.
Thank you.
Anybody have an idea? What are those? Those are,
Chemoreceptor?
yeah, good.
Mm.
All right, a rise in the extracellular fluid osmolarity would cause what to happen? So if our blood became, does that mean that our blood becomes more concentrated or less concentrated?
More.
More, right? So if our blood is concentrated, what is that gonna trigger?
The thirst center.
Good. Anything else?
Well, release of ADH.
Excellent. Very proud. When a person is overhydrated, what would happen to these following hormones? Would they increase or decrease? So ADH, if they're overhydrated, any,
Decrease?
what?
Decrease?
Decrease, good. Okay, right?
It's the opposite of
Okay.
ours.
ANP, Jake,
Increase.
increase. Excellent. Aldosterone? April,
Decrease?
decrease. Alright. Angiotensin 2. Ariana?
Decrease.
Good. Excellent, good job. All right. We still got lots of time. So, the only thing that I wanted to do is I wanted to show you this. Now, I'm afraid to tell you because I know once I say that it's not on the test, you're just gonna like, not look. But I think that this would be very, very helpful to you, especially when you start working in a clinical setting, especially if you're working in the hospital, because you will see older patients all the time with these conditions. And like, the other day, my cousin, called me, it was during spring break, and my aunt, she's got a little bit of Alzheimer's, so all of a sudden she started experiencing like paranoia and hallucinations, and I'm like, oh, sounds like it's probably a urinary tract infection, because urinary tract infections make old people like loopy.
Yeah.
Their whole behavior changes. However, no infection anywhere. But her electrolytes were all out of whack. Her potassium was crazy, her calcium was crazy, and that really has a big effect on things. So I'm not gonna test you on this, all right? But I think it's really beneficial for you to have kind of an understanding of what these things do. And I know something that like often affects people is potassium levels. So I just remember as a resident always like trying to figure out, oh, their potassium is too high, we gotta give them lactulose. And they like, the lactulose binds to potassium and they poop it out. But these levels get all crazy, especially if we have somebody that has renal failure. Older people's bodies just don't work as efficiently as younger people. All right, so question, you wanna do the heart or blood vessels?
Good question.
How many say heart?
Let's just do the heart. Yeah, let's see the heart.
How many do blood vessels?
Boo.
We got more heart.
I don't remember any. Both.
All right. So, you know what? Let's just go through them. this is the best. We'll just go through them, cause it's too hard, going back and forth.
Oh, this was a waste.
So cardiac muscle tissue is found in which layer of the heart?
Wait, do we raise our hand?
Yes, you do have to raise your hand,
Oh,
and I'd like somebody that didn't get a chance to answer.
it's the easy one.
Rachel or Jacob or
I have no idea, I
Erica.
don't say anything. But yes.
Anybody? You wanna try, Jacob? Wanna try to answer?
I'm just doing it for the money.
I think I.
Nope. Rachel, you wanna try? Okay, Kingsley? Myocardium, good.
Muscle. No,
So
myo means
myocardium
muscle.
is where the
M for
cardiac
muscle.
muscle tissue is found, right? Remember, myo is muscle, okay?
Not mayo. Mayo.
Guys, just remember, doesn't matter if you get it wrong here. All right, which valve is found between the right atrium and the right ventricle? And I'm just gonna start writing
That's
it
the,
on
I
here,
think that's
because
a
it's
tricuspid.
too hard to go back.
Pine? The pine was the same. Shit. Just a tricuspid. I don't remember. Is that the tricuspid? I think it's tricuspid. I want the money, Kai. She posted that. I want the money. Yo, $1 billion.
Okay, which valve is found between the right atrium and the right ventricle? Erica?
Is it the tricuspid?
Excellent.
Damn it. That's
All right. Which blood vessel vessels leave the heart and transport blood to the lungs? Hi.
Pulmonary arteries?
Good.
Nice, nice. It's always backwards.
Which prevents prolapse of the AV valves? That means when they prolapse, that means that they like flap back into the atria and cause regurgitation.
I think it's chordae tendon, right?
Cage.
Chordae tendon.
You guys are gonna have like 150.
Oh, I don't know about that. Don't jinx it.
All right. All of these structures can be identified in the ventricles except,
Ooh.
I don't like this
Pectinate?
one. You don't have to.
Oh, I have it, yes.
Pectinate.
Pectinate, yes.
Don't worry.
Because I don't know it.
All right, blood is carried to the heart by what kind of vessel?
Veins.
Sorry, Gianna?
Veins.
Good.
I don't care anymore.
Of the following, what is the best definition of arteries? Erica?
Carry blood away from the body.
Excellent. Excellent. Blood being pumped out of the left ventricle enters
The aorta?
April?
The pulmonary artery?
No.
Aorta.
Kingsley?
Aorta?
Good. Okay. Blood is preventing from flowing back into the left ventricle by what?
I think that's the
Erica?
mitral valve.
The mitral valve.
Ooh. Semilunar?
Right?
Is it the aortic semilunar valve?
Excellent, good, okay. So remember, backflow, so we said it goes left ventricle, then the aorta. So we don't want blood to go back, so that's the aortic valve that separates the two. All right. Deoxygenated blood from the myocardium enters the right atrium. So this is like more like coronary circulation. I don't think you really need to know this. I'm not gonna ask you something like this. But, just so you know, the coronary sinus is basically what all the cardiac veins drain into. And the coronary sinus drains into the right atrium, okay? So just make sure you know that. All coronary veins drain into the coronary sinus. Coronary sinus drains into the right atrium.
Can you repeat that?
God bless you. Okay.
Closer.
All coronary veins empty into the coronary sinus. Coronary sinus empties into the right atrium. Without SA node input, what would the heart rate be? You're gonna have to guess about this. Gianna. Not Gianna, I'm sorry, Nadine.
Would it be 15 beats per minute?
So remember, SA node is going to keep the heart rate between what? What's normal heart rate?
60 to 100.
60 to 100. So if the SA node isn't working properly, what takes over? What's the next in line? Goes from
SA
SA
AV.
to AV, right? So the AV node would take over. Okay. Anybody, this is an anatomy question, so I'm not gonna ask you that. Okay. Atrial repolarization occurs during this period of time.
That's a big wave.
Erica,
Is it the QRS conference?
excellent, excellent.
Yeah.
You're on fire too. Okay, remember that we don't really notice it because the ventricular repolarization is occurring at the same time, so it's kind of hidden in there. Okay. The entire ventricular myocardium remains depolarized during this time on an ECG. So let's try. So we didn't talk about that, so we're okay with that. We are not going to worry about that.
Dead vipers.
Okay, how about this? The love death heart sounds heard during auscultation of the heart are associated with what?
The valves. B and C.
Is it
Any?
the heart valves closing?
Excellent.
I thought it was opening and closing.
And all four heart valves are closed during what time?
Is it C? You checking?
Did I call on you?
No. Damn it. Is it right?
Kingsley.
D.
Oh, I got it wrong anyway.
Good, okay.
I got it wrong anyway.
Isovolumetric contraction. Remember, isovolumetric, right?
Okay.
Nothing changes in the ventricle, so that means all four valves have to be closed. That means the volume isn't gonna change in the right ventricle, volume isn't gonna change in the left ventricle. During what phase does stroke volume decrease in the ventricle? I don't really like the way Alright, this is fair. During which part of the cardiac cycle is pressure in the ventricle at its lowest?
D.
What you said?
D.
D? Martin?
Is it ventricular ejection?
Think about that. Systole is what, contraction or relaxation? Contraction. So pressure's gonna be pretty high, right? Any,
Is it B?
Ariana?
B?
Kingsley?
C?
How is it okay?
Aye.
Mid-diastole.
Oh, that makes sense.
Alright, so mid-diastole, right? Diastole is ventricular relaxation, right? So the ventricle is not contracting. If it's not contracting, that means pressure is pretty low. Okay. Greatest decrease in ventricular pressure occurs during this time. I don't really like this one. Alright, amount of blood pumped out of each ventricle in 1 minute. Okay,
Stroke
Cardiac output.
April,
Cardiac output?
good. Right, so you're thinking the amount of blood pumped out in each heartbeat, but we have to multiply the heartbeat times the heart rate, okay, to get the minute. All right, increase in the heart rate by the sympathetic nervous system. We did not talk about this, so I'm gonna skip it. All right, an increase in the end diastolic volume would have which effect? This is too tricky. Okay. We can talk about that. Okay, so hypertension, this is a little bit tricky too, but hypertension can decrease cardiac output by causing an increase in what? An E?
D.
I think it's C.
C.
Stroke volume?
Yeah.
Yeah? Maybe? No? Oh, damn.
A?
No, it's actually A.
Oh.
Okay.
Tricksters, tricksters.
All right, the end systolic volume, okay? Basically what happens if we increase blood pressure, right? That increases our afterload. It makes it harder okay? So it makes it harder for the heart to pump blood out at any given point. So what that means is that less blood leaves the ventricle. With each beat. So, okay, what that means is that if we increase the end systolic volume without there being a change in the end diastolic volume, right, then our stroke volume decreases, our cardiac output decreases. Okay?
So what happens when you have low blood pressure and you can't even get the blood out?
Well, when you have low blood pressure, right, that means that there's less resistance. So it doesn't, if your heart is beating, right, if your heart functions properly and your blood pressure is low, we're not gonna have any problems getting the,
But if it's like hypotension, like below normal,
well, then those other things,
I would think like
come into
less blood
effect.
would come out too, but I guess not.
right?
Okay.
Less blood comes out because, there's less blood volume, so all of the volumes would be affected, right? Not just the end systolic.
Okay.
Okay. We have 5 minutes to do our blood vessels,
I'll take it.
so let's do that.
Oh,
Alright,
is it the capillaries or arterioles?
so the smallest blood vessels in our body.
Capillaries, arterioles.
Mariana?
Capillary.
Good.
What's Trickle's arterioles?
Which is the muscular layer of blood vessels? Gianna?
Tunica media.
Good. Venules are going to unite to form
Veins.
veins, good. And all of the following are found in large arteries except one.
Yes.
Five?
Valves.
Valves, good. Right, we don't need valves because arteries are high pressure and the pressure gradient is gonna drive the flow of blood, so there's not gonna be backflow. Sorry.
Distributing.
I screwed that one up, huh? Okay. Which vessels carry blood towards the heart? I think we saw this one already, right?
No. But anyway.
D.
Venules, good. All right, exchange between blood vessels and cells occurs where?
It's
Anybody didn't get a chance? Ashley, you want to try?
I don't know.
Okay, it's okay. I think guys, Nadine's seen that before. Good. All right, which vessels control blood flow to tissues? Martin,
You can see.
capillaries?
that's what
Or the
arterioles are.
arterial, right? All right, sinusoids are a highly modified form of what vessels? Any?
B.
Gianna?
D.
Good. Okay, capillaries.
Capillaries comes up a lot.
All right, and these vessels serve as a blood reservoir, which means that they are the ones that hold the majority of blood volume.
That's veins. Oh, shit.
Alejandro.
Is it B veins?
All right, if you have a blood pressure of 120/80, what's your diastolic? Ariana? Good. Okay, diastolic is, low blood pressure. And what is the pulse pressure if your blood pressure is 110/80?
Is it 30?
Good. All right. Have a great weekend.